Hey guys, welcome to Podiatry Practice Mastery down here. I'm going to go over the things that helped get the practice to the $1 million mark and beyond. A couple of good things that are happening today. We've had, I think we remediated our ModMed training, so we had our trainer come out twice, so 2 days, and then another 2 days. And it's really because one of my partners was off on vacation when she came, and she came in helping the second time. And one thing I kind of wish I would have known, or maybe I should have realized, is everything has to be really bad before it can get better. So we are on day number 11 of our implementation. It's getting a little bit better. I feel more confident at getting the level of notes that I need. Morali is getting the hang of the which templates to use, because there's so many different plans that you can use. So just trying to find the right ones that work well. One thing that I did, as I mentioned before, any big transition, I like to use something called a positive focus, where I write down 10 good things about the day. One of the main things is I originally used to print out my patient schedule every day, and I used to write notes on that. And I don't like the way the new ModMed schedule prints out. Actually, I didn't really like the one that Athena printed out either, but it was just what I did. But instead of doing that, what I did is I print out a daily patient tracking sheet. This is something I've tried to use in the past, but I figured out a little bit better way of doing it, and that's what I'm going to be using to track my patients from now on, instead of doing the printout. So it'll save paper, I guess, but more importantly, I can just write down my main thoughts if I can read my handwriting. The big problem is reading my handwriting here. So today, did that. Did a couple of wounds, made it a little bit easier for the wounds. Their wound template's pretty good in the ModMed. I sent a couple of complex patients to get surgical consults, as well to the wound center. Kenya was our trainer, was there helping us out. I set up a couple of filters within one of my screens that I had to look at, so I don't have to be overwhelmed by everything in there. And I also learned more about Clara. Clara is an add-on thing for ModMed. I think it's owned by ModMed, and it contacts patients before them, asks them to fill out their paperwork. It also has something that might be able to replace Swell. Swell is what we use for our online reviews to get them. So it actually has something where every patient, after they come in, it can send them information out to give the online review. How was your experience? Would you give us a review? It has more of a feel like Athena, meaning it, how do you say it? I think it's illegal, but what it does is it says, did you have a good experience, yes or no? And if you say no, it'll ask to give a comment. If you say yes, then it'll ask to give them a review. So I'm not sure if they're supposed to do it that way, but that's what, from what I understand, that's what it is. Also, I've realized Shockwave is a lot easier with the procedures because it remembers everything. So Shockwave's getting easier. My partner is using the iPad component. He really likes the transcription component of it, so you can use Dragon right inside of it, and things are kind of working better. So let's go over the patients. So I still had less patients here. I think as we're still booting up. So 55-year-old female, level 4 visit. She had very severe plantar fasciitis. This is one that didn't resolve from Shockwave. She had 6 sessions, then I did another 3 sessions, and then she just wasn't better. So she's going to be seen for a surgical consult. She's had it for over 6 months. She's frustrated, so that's what we're going to do. Next one was a 54-year-old female that had number 2 out of 6 for a painful os peroneum that was referred over to me from another provider. 74-year-old male that we did medication management. We changed his gabapentin, so it's a level 4 visit, and we are going to check on Qtenza for him. Next was an 84-year-old female, level 3 visit, EPAT number 1 out of 3. So I can't even read my handwriting. I'm sorry, guys, but we did EPAT for her. Next was an 80-year-old female. This was a patient that was given diflucan from another doctor, didn't feel comfortable taking it, came to talk to me, and I just kind of went over the options with them, and then I debrided the nails. Next was a 50-year-old female that wanted to do a nail sample before he took the tryptophan. I've had a lot of patients coming in because we have the lunula. They're wanting to do laser. I just don't find it works as well as the oral. That's just my experience. If you guys know any different or feel any different, let me know, please. Maybe I'll change my ways, but I still tend to do more oral medication than anything. Next was a 80-year-old female. She had an ulcer on the anterior leg with some venous stasis and edema. I did an Uniboot on that, and she had a pressure ulcer on her heel, neuropathic, and on the left side she had a BKA. So I'm going to send her to the wound care center to deal with these. I don't deal with a lot of these wounds, especially if they get messy. Next patient was a 40-year-old male with first MPJ, first actually met cuneiform joint, and she's feeling much better after doing Shockwave therapy on it for met cuneiform. I think she had an old Lisfranc injury that was never healed. Next patient was a 8-year-old girl that had some maceration between the fourth interspace. I did lamb's wool and some betadine. If it doesn't get better, we'll do athlete's foot cream. Next was a fibroma, 55-year-old that was status post 3 sessions of Shockwave. She wasn't any better, so I did a cortisone. She felt better after that. She has orthotics, and then she's just going to come back as needed for cortisone. And then the last one actually was that one, the met cuneiform joint that has a lot of bad arthritis. She felt better after the 3 Shockwaves, so I kind of talked to her about having a maintenance plan, like every year coming in for Shockwave to help with that bone marrow edema. It's not going to take down the arthritis, but it'll make her feel much better. Okay, those are the things for the day. Thanks.